كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to this series. Today we will be talking about substance abuse and drug related disorder. Substance abuse actually is the issue about using drugs which are not legal, or even using drugs which are legal but in the wrong way, in amounts that it's not appropriate, and also using them in a way that is not the way that is supposed to be used. And this actually leads to self-harm and also harms the society in general. So drug abuse or substance abuse basically is the using of drugs in amount that is not appropriate. Usually it is more amounts, and also maybe taking them in a manner that is not supposed to be taken. For example, a drug that needs to be taken through the mouth, but somebody takes the same drugs and injects it to the blood vessel. So the wrong way of using the drug, this is actually drug abuse. And in drug abuse, basically, it could be a drug that is not legally supposed to be used for that purpose, so it is being misused. But it can also be a drug that is actually a legal drug. It could be a medication that is actually supposed to treat a particular condition, but now it is being used to give somebody a different effect, or it's being used for different uses. So the effects that are intended are not the ones for treating, but for this person either to feel different because of those drugs. So some of the prescription drugs, these are drugs that actually the medical doctors prescribe for these patients, or for people to have and use them, then they're used for the wrong way. And currently, a drug, for example, the cough syrups, which have codeine, they've been seen that people take them and they use them not because they are sick or not because they want to be treated, but because they want to have that feeling of feeling better, feeling high because of using that codeine. So these drugs could be legal drugs, or they could be prescription drugs that have been given, or over-the-counter drugs. These are drugs that people go and buy at the chemist, and then they're being used in the wrong way. And substance abuse actually currently is a big issue. The magnitude has been shown. Some studies done in the year 2010 shows about actually globally around the world, almost 230 million people are substance abusers. They are drug abusers. And out of these 230 million drug abusers, almost 27 million actually have the harmful effects of these drugs. And as I mentioned, that some of these drugs actually they prescribed, the legal drugs that are being used. And out of all these, about actually 7 million of these drug abusers actually are abusing drugs that are actually prescribed. So it is a big problem in terms of the use. It's a big problem in terms of the accessibility. We know that currently the access of these is become more easy because people either they can get them from the chemist, from the pharmacist, they can buy them, but also there is a lot of illegal drug use that actually can get into the hands of the communities, especially the youth. So the access has become more, and it is the use has become more rampant. The other issue that has actually facilitated substance abuse is the format that they come. We know currently that there are even sweets associated with the drugs. They can actually can be made into the format of, so that they look like sweets. They can be in the format of, for example, in nicotine abuse, in tobacco abuse, what we call the e-cigarettes. They can be brought in like electronic devices that actually can be used. So the format has also increased the use and the access of these substance abuse, and it has become more rampant in the youth. Our children actually get more exposure to this, and some of these drugs actually are very common, and some of them are actually not even termed in the legal basis. They're not illegal. For example, the cigarettes, actually they are being used and it is legal. People can use them. There are no prohibition, and we know they are actually one of the main things that our children are using, and they're causing a lot of diseases like cancer of the mouth. We know there are drugs like the gut, that is Mira, which is also one of the main drugs that are being used by our society, and gut has been shown that it has a lot of effect in terms of the physical body, in terms of the mind, and it, in the long run also, it affects the society. We know drugs like cannabis, that is bang, it is being used. It is an illegal drug, but there's a lot of access, and many of the societies, many of our youth are using these drugs. Some of these other drugs are actually medication drugs that are used either, for example, treating pain. It could be for treating joint pains. It could be for treating headaches, or it could be for alleviating some pain that a person has, but the people now, they go and use them so that they want to feel high, and these affect them in the long run because they get used to them, they get addicted to them, they get dependent to them. So once they get dependent to them, they cannot do without them, and also they also get high tolerance to the same drugs. That is, they actually need to use more and more of these drugs to have the same effect that they have on them. So if a person, for example, was using one drug, later he needs to use two to get the same effect that he used to get, and it actually moves up to 3 and 4, and then this person actually gets addicted to the drug. Other substances also that are used, like alcohol, which is very rampant, and it is being used in the societies. So these are some of the drugs that actually are abused. Other hard drugs like heroin and codeine, the cocaine, they are used very rampantly, and the accessibility, which is illegal, has actually increased the use of these drugs. These drugs actually have a lot of effects, and to the individual and also to the society. So there are physical effects that actually these drugs have on the person. There are mental effect that they have. We know a drug like bang actually can cause psychosis. It can cause mental problems, mental changes. It can cause schizophrenia in these people, so that they become mad in a local terminology. And we know that alcohol is also one of the main causes of social problems. It is one of the main cause of road traffic accident in terms of the people who are using it while they are drunk and then they are driving. We know it also leads to a lot of domestic violence in terms of now the people who are using it assaulting others at the household level. So these drugs have some physical effects, they have a social effect that they cause to the society. They also, in the long run, they affect the people economically, because they'll need cost to be treated, they need cost to be managed, and this in the long run will affect the people in terms of their health, in terms of the economic productivity and the society networking. And it is very important for us to have at least an idea if somebody is using this substance, what are some of the few things that we might look into so that we can know that this person most probably, or there's a possibility, is using drugs. And it's very important, for example, to check the person behavior, because in the long run they'll affect this person's behavior. If this person, for example, was quiet but suddenly changes and is very talkative, he's become very outgoing, he's become very extrovert, there might be telltale signs that there is a problem, or this person is using some substances, or the person might have been active, but now the person becomes more calm, becomes more silent. These might also be signs that this person is having or is misusing drugs. You might have a child who was well behaved but now becomes very difficult, is not listening to what he or she being told, is running away from school, is not attending school. So these are some of the signs that we might see in changes we might see in either in our children or in our youth or in the society or in the individual in the society that show us that this person is actually using substances. So it is important to be on the lookout. It's important to be alert. It's important actually to have high suspicion index that this person could be using these drugs. And this is so that we can actually be able to tackle the problem early. We can be able to give these people medical attention so that they can be managed early enough so that it does not go to a level that actually these people have become addicted. The other thing that also can be seen in these people is that if somebody was using certain substances but now is not having that substances, there is what we call withdrawal symptoms. This person might be very agitated, might be very aggressive, might have the body might be shaking, that might be having tremors, so that this person actually cannot do what he used to do without using the substance. So this is some of the signs that actually can show that this person actually has been using drugs and maybe now is not having them and is having this side effect. So it is important for us to be alert so that we can actually pick out some of these changes very early enough, and they'll help us in the management of this person so that it does not move to a level that we cannot be managed. And this will help in the long run to contain the person in doing this. The other issue is very important, the issue of accessibility. How we can actually prevent people from getting this access of these drugs so that they cannot be abused. We'll take a short break. Once we come back, we'll continue and discuss how we can actually manage these drug substance abuse and drug-related disorders. Welcome back to this series where we are talking about substance abuse, drug abuse, and drug-related disorders. As we had mentioned earlier, that the access has actually increased the use of these drugs, and it is important for us to know or to try and see how we can reduce this access. And one of the things is actually to give our children, our society, the information about the negative effect of this so that they do not start using them. The second thing is actually if we know where these people are getting them, that they can actually be prevented from being available, and once, if these are the prescription drugs, we can at least ensure that the institution, the chemist, the pharmacist, they actually prescribed for a person who has a prescription from a medical person, and also to be given to the right people so that they're not being misused. The other thing that is important to know is that these people who use them, they need actually to be managed well. And one of the things that they can be managed is the issue of counseling, psychological therapy, so that they are taken through, talked to, they understand the evils or the negative, the harm of these substances. Once they know, then they're given other support so that they can stop using them. One of the other areas that in management of this, in some cases, some of these drugs that are being used might need medical therapy. And in medical therapy, in some of these drugs, actually, they are given alternative to what they're using, so that they have less effect, and they are removed slowly by slowly, as they're given this alternative, which are usually not harmful as the original or the drugs that they're using, so that they can actually be weaned off. So they are moved from the hard drugs that they are doing to these that are medical drugs, so that they can actually leave what they're doing. In other circumstances, they might need to be taken to rehabilitation centers. We know, especially for drugs like alcohol, they might need to go to a rehabilitation center. And in this center, they can actually be managed. And in the management, it might combine several therapies. There might be the counseling, might be the psychological aspect of it, some medication, and also more so the support that they're getting in that environment. And usually it stops them from getting access to this medication, these drugs, so that they do not use them, they do not are tempted to go back to what they have. The other very important aspect of this drug management is actually the society, the community support. They need not to stigmatize this person. They not need to push this person away just because using that drug. This person needs to feel that I have support. I can actually rely on the people that they are around me, and these people, more importantly, should be people that are not encouraging or are not having peer pressure for the same person to use the same substances that he or she has been using. So the society, the people that are surrounding that person should be people who are really concerned, and they are ready to support this person to get off from these substances. And we know that once these people are using these substances, the harm that causes, from the physical harm to the social harm to the mental harm and even the economic harm, actually can be very large. And it is important that they are maintained, it is reduced, and they are stopped from using these medication. Other management that actually people can follow, we have the legal issues in terms of people should know if you're using these substances, especially the illegal substances, you can actually be jailed for the same. We know in some other countries, people who use some of this illegal, their punishment is actually death. So we can also caution people, can also caution our society that the use of these substances is illegal, and it can actually lead you to jail, or it can lead you to a death penalty in other countries, in other people where it is not allowed. So it's very important for people to know the consequences of using this medication, especially outside this country. So some of the few things that we really need to do so that we can prevent these drug substance abuse is one, we need to inform our people about the harmful effect. We need to tell our people some of these medications that they use, and if they're used wrongly, what could be the side effects and what could be the effect that it will have on these people. So once people know and they avoid them, it will be one of the way. We also need to reduce the availability of these substances, especially amongst our youth, so that we can actually cut the supply of these substances. The legal prescribed substances, we need actually to make sure, especially for the law enforcers, to see that they're actually given as expected, given as prescribed, and not to any other person. We know there are other substances that are actually can be gotten very easily from, for example, from the hardwares. We know there are many street children who actually are using the inhaled substances, things like the glue, which actually affects them in terms of their mental perceptions, in terms of how they feel. They feel highly, and they need to be stopped. So they need to be integrated into the social institution that actually can help them and stop them from using this. And we know that they can get them very easily from the shops, the hardwares, and it needs to be regulated and stopped. So once a person has started using this, it is very important that this person is supported to get management, appropriate management, which could be at a different level, as we had mentioned earlier. And the earlier the person is helped, the earlier the person is given the treatment, the earlier the person is given this management, actually it is the better, because the addiction stage may not be as high, and this can enable easy stoppage in terms of this person has not gotten very used to it, because once it reaches a point that this person is really addicted, it takes a longer time, it will need more management, and even the cost will be more. So it's very important for all of us to be alert. It's very important for us to know some of these substances that they are abused, and more importantly, to stop them from getting to our children, from getting to our societies. And once the people are using them, the people who are abusing them, what is it that we can do actually, so that we can give them support? So the issues of knowing the counselors, the issue of knowing rehabilitation centers, the issue to know the facilities actually where they can get this support is very important, so that actually it does not continue. And more importantly, the prevention of people from starting this substance abuse is actually more important in terms of these people should not get addicted. And we know some of these substances, actually even one trial, using them only once, actually can get somebody addicted to this. So issues to do, for example, with cocaine, even one trial is enough to get this person addicted. So the prevention, stoppage of these people completely from even starting is better. We know things like cigarettes and alcohol, which are very easily accessible. It is important that our children, the issue of exposing them very early enough should be prevented. Even as early as when they are children, we know just the smoke, for example, of a cigarette, and the people and the children are trying them because they're seeing the people around, or their peers are doing it. It can actually lead to addiction. We know alcohol, once somebody starts, it can actually lead to tolerance, and he can get used to the amount, to the little amount, so that he will need to have more and more and more. And once he does this, he will get addicted, and this will be a bigger problem. So it is very important actually to prevent these children, to prevent our society from using these substances, so that they do not start using them from the beginning, so that they do not start the usage. So that once they do not use, they do not start, is actually better than after they have gotten used to using them. And it is important also to realize that once these children have started using them within the society, it will be difficult for them to stop, especially if they're not quite open to the people that they're living with. They're not close, they're not free in terms of discussing the issue. So we need to be friendly to our children. We need to make them know what are the harmful effects of some of these substances, so that they do not begin and they do not use these substances. And also to avoid some of these so-called modern types of formats of these substances that are being used. We know, for example, that even this, the Mira currently they are used for the same. We know that the cigarettes, we have what we are calling e-cigarettes, and we know that there are even some form of drugs are put to look like they're sweet. So we need to be more cautious. We need to be more alert, so that we do not or we do not support, or we do not know that our children are using these substances. So the stoppage from not using is better than once a person uses. But once a person is using, we need to know the symptoms or the signs that this person could be using the drugs. And once we know that they are using these drugs, we need to know the ways that this person can be supported, so that they can actually be rehabilitated and they can stop using these drugs. And we really encourage people to be in the lookout, so that they know that, especially with their children, they are not using these substances, so that we can have good and productive societies. Okay, thank you very much for being with us. Next time we'll be back with another topic that will help us with the healthy lifestyles and our health. شكرا.
كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي